When trying to decrease the negative effects of hospitalization in a preschooler, I'm going to consider their developmental stage and also the stressors within those stages as well. I know that a preschooler would be in the psychosocial developmental stage of initiative versus guilt per Erickson. In this stage, children are discovering new ways to initiate their actions while also exploring their environment on their own. When it comes to their cognitive development, I know that a preschooler would be in the pre-operational stage per Piaget. This is where they are coming up with symbolic thinking and also exploring their imagination and memory. So considering the stressors for children in these developmental stages, I know that a big stressor would be separation from their caregiver, loss of control, also fantasy thinking, and body mutilation fears. So my job as a child life specialist would be to implement an intervention to address these stressors. I would consider doing medical play with a doll. This will help familiarize and educate the patient on upcoming procedures that they might be having, while also clearing up any misconceptions that the patient might have as well. I would also want to do a medical scavenger hunt with the patient to familiarize them with their environment as well. Depending on their accessibility, this can be done at bedside with a patient maybe pointing at things with a flashlight, or if they're able to get up and move around, we can do a scavenger hunt on the whole unit as well. Within these two interventions, I would also want to incorporate parent involvement. This can help with the patient and the caregiver's attachment and also engage in family-centered care as well. A few other actions that I would want to incorporate into my practice that may not be considered interventions would also be returning control to the patient by allowing them to do simple things like pick the finger that their pulse ox would go on, or choose the type of pillowcase that they would want at bedside. So through the use of these actions on my end, this will help decrease the negative effects of hospitalization for a preschooler.